asthma is most times genetic. Yes, it's in many cases you find that there is a family history of asthma. And so it might not have been diagnosed. It might be of a reduced severity in older generations. Yeah, but most times there's always a genetic predisposition that is usually in your genes to react abnormally. Sometimes it also happens with increased environmental exposure to certain allergens. So
allergens like?
So you, for instance, you find some people are always sneezing. They're always sneezing abnormally when there's probably someone cooking in the house with fumes, when there's dust. You know, in fact, some people, it's with the dust from the rug in their homes. Some people, it's grass. So when they are reacting abnormally over a long period of time, you know, they end up developing asthma that becomes more pronounced, especially in adulthood. So I have a friend, for instance, she didn't used to have asthma when she was younger. Yes, but she always had catarrh. She was always having running nose. But at the end of towards when she was about 20, 21, thereabouts, she then began to, develop severe symptoms of asthma. So it's something that can essentially, also be determined by environmental factors as well.
How can you recognize it early? Now let's talk about newborn babies.
Yes.
How can you tell that this child has asthma? Like how do you tell?
Okay, so with babies, we're not usually quick to say they have asthma. Yes, we usually like to say they have they are in acute respiratory distress, right? Because asthma is more or less a chronic condition,
so it develops over time.
Yes, so a child can react for the first time abnormally to his environment or to some stimulus, but then as the child grows older, gets used to it, the immune system is able to take care of all those, offensive stimuli as the child grows up. But in a child, to recognize those symptoms, like I said, one important sign is to always notice when the child is breathing faster than normal.
Yes.
Okay.
Sometimes the children might cough, but in many cases, you find that younger children are not able to cough properly like we do because they develop that cough reflex over time. Yeah. So it's always better to be very observant. Even simple things like noisy breathing. The child is breathing and you find that it's grunting and it's and all those kind of sounds.
Yeah.
You find that it's not normal. You should get this child attention. You find that some children, many mothers usually come with this to the hospital, that their children's nose is blocked. They can barely breathe. It's always I laugh when I get those complaints, but it's better to be safe than sorry. It's better to actually take appropriate action, get to the hospital and let the doctor be the one to tell you everything is fine.
Okay.
It's not that serious. But for you to stay back at home and watch the child and just do nothing and hope that some miracle happens is very wrong.
This is quite interesting and enlightening as always here on To Your Coffee. Okay, so there was one I'm going to ask. You were talking about blockage and you were talking about the passage, the airway reducing. So there's this common practice which might be a total deviation from what we're talking about in mothers when they notice that their child is breathing heavily or not as usual and they suck. They attempt to suck the mucus out of the nose, especially in newborns. I don't really get it. What is the thing behind that? Is it that you're trying to expectorate? Is it that you're trying to clear the airway? Does that actually work?
Okay, so what you find in children sometimes is that they are not able to, their cough and sneezing reflex are not very as developed, you know. So you find that they are not able to expel these mucus very well as we adults are able to do. So when mothers attempt to do that, that might sound crude, but it can actually be life-saving.
Oh,
Yes.
okay.
So what you find, what is ideal is for them to have a suction that they can put in the nose. You usually find this in delivery wards. When they just deliver a child, you want to clear all the mucus from the airway and all of that, you suction. So yes, it might be a good idea to have such
Device?
such a device, yes, at home for caregivers. Yeah, find that people with asthma, children, adults with asthma, would usually have cough that's particularly worse at night. So they cough more at night than during the day. Yeah, and then, as you said, they always have this difficulty in breathing. You might not notice it just by looking at them, but when they're talking, they would have what you call pressured speech. They won't be able to finish their sentences. They would literally not be able to make complete sentences. Yeah. So you know that it's becoming something serious. You see them breathing heavily. Yeah, you hear noisy breathing. Wheezing, particularly. Yeah. So you hear all of those noises. You know that this person looks like it's having an asthmatic attack, and the person needs urgent attention usually at those times. So what usually causes these symptoms essentially is, like I described, the narrowing of the airway. So when you have the airway being narrowed, it's more like, a space that used to be this wide, when air is passing through, when the lumen is becoming narrower, when air begins to pass through, it begins to make whistling sounds. So you discover that it's easier for you to whistle when you have your mouth. Yeah, so that's exactly what causes these wheezing that you usually hear, this noisy breathing that you usually hear amongst children and all of that. And usually it's best to get them urgent attention, to get them to the hospital as fast as possible, yes. The sputum can also give an idea, what kind of organism is involved, and it helps us as the doctor, as the practitioners, to treat appropriately with antibiotics. So with aside cough, there's also fast breathing. So when you notice that they are breathing fast, and with that, there's a sign to pick up a chest indrawing, that I mentioned.
Okay, yeah.
Aside that, also, you find that children would come down with fever because it's an infective. So those are the three major, signs and symptoms. Symptoms to pick up. So you need cough, fever, fast breathing, chest indrawing.
Okay.
With pneumonia, there are a myriad of, causes from the host factors, which in many cases, young age, children of, younger age are usually more prone, and adults above the age of 65 are usually also more prone to pneumonia. Then aside that, you also have malnutrition, playing an important role. So you find that many more malnourished children easily come down with pneumonia because they're also, you need nutrition to build your immunity.
Exactly,
so when you have
defense system.
Yes, so when you also have some other diseases that weaken the immune system, then it's easier for you to come down with pneumonia, because you find pneumonia also being caused by viruses, like I said, and those spread. Those those organisms literally take advantage of low immunity. So that's on the host factors. On the environment factors, which is very key, you find that poor sanitation plays a very, very big role. When your house is not properly, it's not kept tidy, it's a big problem. Overcrowding is a big problem. So you're not having cross ventilation. Air cannot, pass from one way,
All I can think about is public buses. Yeah.
So imagine those people who live in face me and face you houses with 10 people in a room, just one small window. When one person coughs, the whole
everyone
take your share.
Yes, more or less when they're actually children, who have low immunity. So that's also one thing. Then also air pollutants, particularly.
Okay.
So you have, and it's hard to live without air pollutants in Lagos.
I mean,
you have the buses pumping smoke in your faces. You have generators pumping fumes and everywhere.
And not necessarily Lagos, actually. I think everywhere, considering the prevailing weather condition and the climatic change.
Yes.
Yeah, that brings me to the other cause, environmental factor, cold weather.
Yes.
Usually cold weather is not a direct cause, like I said. It makes it easier for the organisms to spread.
Right,
yeah, so when people say, don't sleep on the floor, you catch pneumonia, it's not like that. Yes. People always feel like it's cold that literally causes it, which isn't. It's good to take precautions and say, okay, let's maintain a good temperature, normal temperature, so that these organisms cannot, survive.
Okay.
So
and
now,
hygiene, I suppose.
Yes, that sanitation comes with personal hygiene. So brings me to prevention.
Yes.
Yeah. So the very first thing that I usually like to teach people is to learn to know how to dab when they cough. Yes.
Okay, like literal dab.
Yes. So literally like that. So if you just try to picture yourself dabbing while you're coughing, it makes it easier for you to keep the cough to yourself, at least, first and foremost. So so when you cough into your hands, all you inadvertently do is you think that your coffee is just okay, You cough into your hands and you go ahead and shake someone, you rub the child's face, you touch their cheeks.
Pass it on.
And then you pass it on easily. But with this, you can literally spread it that way. So that's one. It's also important to, hand washing is very, very important.
That's.
Yes. So it's important to wash your hands properly with, soap and water. After using the toilet, before and after eating, after returning from work, because there's so many surfaces that we would have touched. Someone might have coughed somewhere and then you touch it, you don't know, and before you know it, your hand is on your nose, your eyes, you don't know where. Yeah, that's really literally how it spreads. And keeping a very clean environment is also very essential.
You can join us tomorrow for another exciting episode of Tea or Coffee.